Does mewing grow bone in adult faces? My opinion on that question is nuanced. I think that if it does grow bone in adult faces, it's a minimal amount over the medium to long term, let's say a 5 to 10 year period. For example, if you're a 20-year-old and there's two hypothetical paths you could take. One is where you don't mew and you continue to be a mouth breather and have a slack tongue and eat soft, mushy foods. And the alternative path is that you have great tongue posture, nasal breathing, chewing tough foods, and a solid lip seal. And you take both of those paths for 10 years, okay? The 30-year-old version of you is going to look way different if you mew as opposed to not mewing. That's the time scale that we should be thinking about mewing for adults, a 5 to 10 year period. Even if you go 10 years down that mewing path, though, I don't think it's not that I don't think, I know that you're not going to see results like you would with a double jaw surgery or a MARPE, where the mewing altered the A point of your maxilla, which is to say the front part of it, is not going to advance a centimeter like it would with aggressive double jaw surgery. And your mandible is not going to grow a centimeter either. It might grow millimeters, okay? To put a number on it, I don't know, 2 to 3, max. But does that mean we shouldn't mew as adults? The fact that the gains that we might get are minimal? No, and I'll tell you why. Mewing may not grow bone in adults, but it most certainly helps preserve bone in adults. And preserving bone is just as important as growing it. They're both, whether it's growing or preserving, you're pushing the boundary of your facial structure. Playing defense and preventing it from getting smaller is in a sense no different than expanding it bigger. Because if you don't mew, it will collapse in the absence of force loads that you're putting into your bones. All bones work this way. If we load them, they respond. They respond by fortifying themselves the same way muscles do. If we work them out, they go into recovery and they rebuild. I heard Daniel Lieberman, who is a scientist who specializes in evolutionary history, essentially. So he looks at the human anatomy from an evolutionary perspective and tries to understand how do we run naturally, what's our natural posture like, and also how do we naturally load our bones so that they develop properly. And he's quite aware of the importance of chewing and of mewing in general. And Lieberman said, sure, bone growth stops in your mid to late 20s, but bone preservation never stops. And it's our duty as adults to keep loading our bones, even though loading them is not going to grow them. It is going to preserve them. All right, so, in other words, we as adults should mew as if mewing is going to grow our bones, even if the outcome is that they grow slightly or at least they don't go backwards. And by the way, sarcopenia, which is essentially the withering away of the tissues of our body as a result of aging, okay, that's something that has to be combated in the entire body. It's not just the facial bones that want to erode away. It's all of our bones, okay? And that's why it's important to, so to speak, mew our entire bodies. We need to work out. We need to put load on our bones everywhere by carrying heavy things. And the muscles as well, by doing the same thing. And that's how we prevent our body from collapsing under the non-stop pressure of time and of aging. All right, so any adults who are thinking, mewing is pointless, no, it's not. Mewing is needed to preserve bone structure. And to take an extreme example, if you have had expansion to break you out of the mewing downward spiral, or the mewing catch-22 as I've often called it, which is to say that your facial structure is so small that you can't even mew to begin with, so you pop it open with a MARPE or a double jaw surgery so that you can actually put some force onto the roof of your mouth with your tongue, and you can actually seal your lips and breathe through your nose. Now, that's a bone structure that in the absence of mewing will definitely relapse. we all know that there's high rates of jaw surgery relapse. And Casey Lee said that that often happens because patients don't become nose breathers after their double jaw surgery. Maybe they didn't do the MARPI first and their nasal airway was never fixed. Or maybe they needed a soft tissue nasal surgery, a turbinate reduction, or a septoplasty, etc. Point being, lack of mewing post-surgery causes surgical relapse. So, mewing is constant. We mew starting today, and we do it for the rest of our lives. All it is natural use of our facial structure. That's all mewing is. And so, I think we in the mewing community need to break out of this sort of dichotomy between, oh, mewing is pointless for adults, and, oh, mewing is the solution to all of our problems. Neither is true. The truth is, as in all things, in the gray. Okay? There's subtlety to this question. And I think the crux of the subtlety is that we should love mewing and embrace it, if for nothing more than to preserve our bone structure as adults. So I'll leave you with that thought. Okay? Peace out.